So we'll say good morning and good afternoon. Thank you, ladies, for being here. Before each of us starts talking, we'll just introduce yourself. My name is Frida Kumsen, as you guys know, and I've worked in the Liberian healthcare sector for the past 5 years. And cancer care is an area that a space that I have worked in on the charity side of things, and seeing how we can help women specifically with breast cancer and cervical cancer. This year, we supported screenings for those women through my sorority, Zeta Phi Beta sorority, and our Liberian chapter. We worked alongside LCRI in the past. So we have a representative from LCRI on this call, and Dr. Badeau from Mount Sinai is also on this call, and she has partnered for many years with the Liberian Ministry of Health, and specifically with in certain areas as far as the pathology lab at JFK goes, and has a new position, and is hoping to revitalize the work around cancer and bring all the partners and players together so we can see some progress in cancer care in Liberia. So the floor is yours now, ladies. You can start with you, Dr. Badeau, because I know you had started speaking on some of the work you're hoping to reinstitute. And then Christine, I note that you have a meeting, so then feel free to chime in whenever you can.
So if Christine wants to go first because she has to leave, that's fine. Otherwise, I can just kind of briefly introduce.
So you can go ahead, Dr. Zeta.
Okay, great. So as you guys may or may not know, I've been working in Liberia since 2018 with a very strong focus on cancer care, though I do reproductive and sexual health care, more broadly. But my passion as a GYN oncologist is cancer. So late last year, around the end of November, Dr. Jallo appointed me as the advisor for cancer care and planning for Liberia. With Dr. Dunn, we had started the National Cancer Committee, and I've popped in and out of meetings since they were on Zoom. And my observation was that every couple of months they meet, but nothing is actually happening that is moving cancer forward in the country from a collective group of people who are interested in cancer. So what I suggested is that we do a survey reaching out to all the organizations in Liberia that are doing cancer care across the board, all cancers, try to find out what cancers are being addressed in terms of awareness, screening, treatment, end-of-life care, and what counties their work is being done in, so that we can sort of make an assessment of what energy is being placed into each cancer and what counties are not being targeted and that need to be targeted. So I devised a survey, which was a draft survey that I sent to Florence to distribute to the National Cancer Committee. And I wanted everybody's input to add questions. And once we finish that, we will then focus on sending it out to all the organizations so that we can become a cohesive group rather than have individuals doing things that may be overlapping, for one thing, and wasting resources. So that's my goal. I have a couple of meetings set up to try to advance cancer care. There's a company that wants to come to Liberia they are a company in New Jersey that is manufacturing drugs. That's their job right now. They do manufacturing of drugs, and they are interested in coming to Liberia to set up a manufacturing company. So something like that, I think, will revitalize our cancer work, because our main problem right now is that we don't have access to drugs. So I'm meeting with them this coming week, at the end of the week, to try to find out exactly what they are looking into. There was a proposal that was made to develop radiation therapy at JFK, and I'm trying to work with JFK on that, and to see how we can raise funds to bring that to fruition. And lastly, there is I have received a donation from the company Meiotic. They make a teletherapy unit, which they have already donated to us, but has not been shipped yet, to put in the pathology lab so that pathologies that are difficult for our pathologists who need consultation can then reach out to other countries where there are specialists in breast or specialists in prostate to help firm up diagnoses so that we can really establish and guide people to what kind of treatment they need. And with that same company, I'm putting in an IHC, which is the immunohistochemical lab, part of the pathology lab, so that we can identify the estrogen positive, progesterone positive patients with breast cancer, but also do IHC across the board for many cancers that will be helpful, mostly on a diagnostic end. So we're really trying to firm up the diagnostic treatment and supply chain for drugs. So I will just end there and just, we can just discuss.
Thank you so much, Dr. Badeau. And then Christine, I'll switch to you in a second, but before I switch to Christine, do you mind turning on your video or?
Oh, no, I'm sorry, I can't right now. Yeah.
Okay, no worries.
I saw the email, but where I am, I can't turn it. Sorry.
No worries. We just thank you for taking the quick time to be here. So before I switch to you, Christine, I wanted to ask this question to both of you. For someone who has maybe never been to Liberia, but is familiar maybe with what cancer advocacy and cancer awareness and the research and funding looks like here in the US for cancer, how would you describe the situation in Liberia? How dire is the cancer situation in Liberia today? And then in speaking to that, what would you say are the major needs now that partners can maybe come in and help along with? I heard a lot of what you mentioned, Dr. Badeau, about focusing on making sure the diagnostics frameworks are there, that the drug companies have an opportunity to enter the space and have those be accessible. And I know those are major moves for Liberia. But I also know, there's so many needs. We know that breast and cervical cancer are the major types of cancer right now in the country, which means women are disproportionately affected. So speak to if you can, and you can say a word, both of you or either of you in the few minutes that we have left, about what are the major issues or differences you would say that exists between cancer care, advocacy, awareness, funding, even maybe the government's position on cancer versus our government's positions, anything in that regard. And then what would you say partners should maybe have their eye on helping in which areas? I know, for instance, Redemption Hospital it seems to be a supply chain issue of producing mammogram films every October. They have a mammogram machine and they should be providing free mammograms to women, but can't and haven't been able to do that in the past few years because the film is not available. And in my limited research, the pharmacies don't even carry the films because they think there's no demand for it. And so it begs the question, there's so many different areas that you can come in. You can maybe donate mammogram films to Redemption, or you could donate in other ways. So I'll give the floor again to you, ladies. If Dr. Badeau, if you want to say something first and then pass the baton to Christine, or Christine.
No, let Christine go.
You have 6 more minutes, right? So Christine, the floor is yours.
Thank you so much, Frida. So like Dr. Badeau rightly said, most of our focus has been on early detection and diagnosis. Because what we've realized is that most of the women we've encountered got diagnosed at a very late stage, and then it put them at a disadvantage, right? So I think more investment will have to be made into diagnosis. I mean, the situation with Redemption. This is something Dr. Jala and we've talked about for the last 3 years. So there is this machine over at Redemption, but then every time you go to them, the concern is there is no film. So just 2 months ago, I suggested to her, why can't the NCD, the ministry through NCD, purchase the film and then begin to charge patients? It's still going to be very cheaper than when you compare it to Jamali or other places, so that you're able to sustain paying for the consumables when they run out. And also, currently, hello?
Yes.
Yes, we got you. So you were
Yeah,
saying,
you're here.
you're
Hello.
introducing, oh, we lost her. But what she was saying, let's hopefully she can rejoin quickly. But what she was saying, it sounds like, is that they have to think about integrating a fee-for-service model when it comes to the mammogram machine. It has to be self-sustaining. If the ministry does step in and, for instance, purchases those films, it sounds like they're looking at a fee-for-service charge for that. And I think, that is a solution that might work across the entire health sector, because in terms of, especially in terms of supply chain and financing. But Christine, when you rejoin us quickly, you can pick up from where you left off, Christine. We lost you, but we see you now, Christine. You can just
Unmute. Christine, you're on mute.
unmute perhaps and.
Yeah, so in as much as we want to make interventions in terms of treatment, that's fine. But I think the primary focus from from LCR's view is, diagnosis and early detection. So, currently, most of the screenings we did for October and November, which we also had to continue well into December. Sadly, this year, because we did way more, I think we did almost double the numbers we did last year. There were way more cases, diagnosed, and most of them, sadly, were at the late stage. And as always, when you ask that, oh, I went, the only place they told me to go to, they charged like $50, and like I can't afford it. So while we look towards treatment interventions, I think we should also at the forefront just also make sure that diagnosis is at the forefront.
But I agree with you, Christina, but also it's very depressing for the patient to be told they have cancer and then say, we really can't treat you, you have to go to Ghana, right? So I think in concert with making these diagnoses, we have to sort of develop some form of treatment. And
treatment, yeah.
Yeah. And so I think the efforts, while the diagnosis is really important, and we're from my end on the pathology, we're trying to improve the diagnosis. So we actually give the correct diagnosis and get all the markers that will sort of solidify the diagnosis for each patient. I think we have to start thinking about what can we offer these patients in terms of treatment, because it's really depressing to know that you have cancer and then be told that there's nothing we can do for you. So
yes, absolutely. I would agree with both of you ladies and say that, for instance, I'm not sure, Christine, how many women did LCRI screen this year, starting in October? You mentioned you went through December. How many women approximately?
So we had to stop because we did like 1,400.
Wow.
We did like
so
that's
phenomenal. That's phenomenal.
Yes.
And we on the,
and we're still getting calls. We got calls from like 2 lawmakers to go into into their counties. Dr. Beto, you're like you're 100% right, because sadly right now we have like 3 persons in Ghana, and when you just look at the cost of care, the cost of care and treatment outside of Liberia, I mean, like, how many persons can afford it?
Afford it, right? Exactly.
Yeah, I was also just going to add, I think, you ladies, thank you so much again for your time. You both have hit on 2 important aspects, like, early detection and diagnosis is key, but then what, right. And that's something that I've learned in my, the last 2 years of advocacy around this. Christine, the year before, when we worked on the LCRI Breast Cancer Walk Project in October of 2020, or was it 2020?
Yeah.
One of the major takeaways was that, yeah, the screenings are good, but then when you find the cancer, what do I do? Where do I go? And so in terms of partners coming in and helping, this year, what we did was we did partner with Jamali to fund screenings, but that's not always sustainable. Partners can, of course, donate and support the $50 mammogram, but we went even further than that. We said we were going to support not only a mammogram, but a pap smear, so that we could hit breast cancer and cervical cancer and then also finance a general practitioner consultation, so that they sit with a doctor, talk about the results, and that those results get back to their referring doctor at redemption. So we had to reduce the number of women that we helped so we could help more comprehensively, so that we're not saying, oh, we're going to leave you at the diagnosis site and you're on your own. Yeah. And that's where then we referred those women through their doctor at redemption, who connected with the general practitioner at Jamali. Then we may or may not refer some of those 10 women. We've reached 10 women and we're hoping to reach more, 10 women so far, if they have to be referred to Hope for Women for chemotherapy, and we know that chemotherapy and all of some of the other treatment diagnostics are not, are limited in diversity and availability. So that's why I was really happy to hear from Dr. Badeau that there are some visions being made towards bringing in medical companies and other things. But would you say if partners needed to help, right, today, what would be the top 3 things that you would like to see money going towards to really turn around the cancer care situation in Liberia? And then we'll close.
I think supporting the, like you described you're doing with Jamali, supporting these diagnostics and treatment. But I think more importantly, at least from the NCC point of view, we need to have some legislation that the government pays for people, even if it's a minimum. The out-of-pocket expenses for patients with cancer in Liberia is somewhere around 40%. 40% of cancer care is being done by individuals rather than by the government. And I think that's one of the things I'd like to drive the NCC to put in some legislation that can go to support these basic screening things. And one other thing—
we pay for community health, we pay for cancer care, kind of, right?
Right, exactly. So one other thing I want to say as a ray of hope is that, you know, I have sponsored, my organization has sponsored one of the doctors who trained in the OBGYN program, who's now in Uganda training as a GYN oncologist, because we also need, if we deliver therapy, we need to deliver evidence-based treatment. We can't just ad hoc our treatment. So he is due to come back at the end of this year or early next year. And so what I'm working on individually is trying to find a place where he can actually work, because we don't have a setup for treating cancer. We really don't have a comprehensive place for treating cancer. So I would say efforts right now should be geared towards screening, expanding the screening throughout the country, because we focus on a few places, and also for those with pre-cancer to get them the treatment they need. At least that will help stem the tide of, you know, and also I think campaigning for the HPV vaccine. We can give women up to age 45, which I discussed with Dr. Jala, and that as we do these screenings, let's get these patients vaccinated. There's some cross-reactivity in vaccination. So I'll stop there.
And Dr. Badeau, thank you so much. I heard you talk, okay, so I just got a text, my meeting is in 5 minutes. So I heard you talk about the getting drugs company involved. Frida, if I remember rightly, HFL at some point was trying to target bulk procurement. Is that still in the works?
That is still in the works. And HFL is the Federation of Liberia of private clinics and healthcare businesses that are trying to come together to innovate outside of government, you know, to do what they can do outside of government and to collectively do that. But go ahead, Christine.
Yeah, I mean, no, just going back to the issue of the drugs, I think that will greatly help, because every time we go to Hope for Women, that has been like a major issue. The drugs are pricey. Right? Like, just to get the drugs for the cocktail needed for chemo is been a difficult situation for them.
Yeah.
Well, thank you so much, ladies. This was helpful. Again, I'm gonna maybe edit this and share, but the point behind bringing us together today, at least, is this is the first of many, again, a revitalization of the cancer care talk in Liberia, because it needs to happen. Like you said, Christine, and you observe, cancer is on the rise, breast cancer, cervical cancer, all types of cancer in Liberia, but we need to start making those little steps now. So yeah, I'm looking forward to continuing to work with you all. And definitely please keep let's keep each other in touch as things develop. I know I can say that our sorority is willing to help. Zeta, the Liberia chapter of Zeta Phi Beta, is willing to help and continue to help and partner with you guys. So
great. And my organization, is there to help in any way that we can also.
And what's your organization, Dr. Bedot, so we can?
Women.org, it's the Women Global Cancer Initiative. We go under we do business as the women.org.
Mhm.
We sponsored a bunch of the screenings, and we give scholarships for cancer-related training. So that's how that fellow is in Uganda for 2 years. We paid for his training.
Excellent.
And next move is to get a breast cancer surgeon from Liberia, trained outside of Liberia, and come back to promote, a treatment for breast cancer.
Excellent. That's exciting. So those are other opportunities. Maybe those that I'll share this video with can look up women.org and see how they can partner and help and support that as well. Thank you, ladies.
Okay, thank you. Good to
Okay,
talk to
thank
to both of you. Take care.
Great to talk to you again. Okay, bye-bye.
Bye-bye.
Bye-bye.